Hi, my name is Jennifer LeVine, and I'm a physician assistant in the area of urology. And today I'm going to talk briefly about what it means to have hematuria. Hematuria basically means blood in the urinary tract, and the blood can be coming from really a couple of places. First, it can be coming from your kidneys. Second of all, it can be coming from your ureters, which are two long spaghetti-like structures which connect your kidneys to your bladder, or it can be coming from the bladder itself. And the workup really for hematuria is threefold. First, you need to get a CT scan of the abdomen and pelvis with and without IV contrast. This will look for any, big lesions anywhere in the urinary tract and in the abdomen or pelvis. And you get IV contrast to really see if there's any tumors or masses. And basically IV contrast is injected intravenously, so they would need to start an IV. And this is administered through the IV. And it's important if you have any allergy to shellfish that you cannot receive this iodine contrast. So that's really important as an allergy to tell the nurses when you first go in. So after the CT scan, there is something called a cystoscopy, which is basically a camera which goes into the bladder itself. It's kind of like a colonoscopy, but instead of inserting a camera into the colon, it's inserted into the bladder itself. And that part of the exam is important in conjunction with the CT scan, because the CT scan cannot pick up any superficial lesions that can be seen in the bladder. So those two together really are the full workup for hematuria. And there's a couple urine studies that can be sent off to look for funny looking cells. So if you see hematuria, it could be anything from a urinary tract infection, kidney stones, or it could mean something a little more serious like bladder cancer. So having blood in the urinary tract is not a normal thing, and it needs to be worked up by a competent urologist. So just wanted to briefly tell you about hematuria, and look out for other topics that I'm going to cover. I'll try to explain them as best I can so everybody can understand them. Thanks for listening. Jennifer LeVine, I'm a PA in urology. Thanks.